Hello, my name is Greg Stock. I'm the CEO of Thibodaux Regional Health System. Today we have Dr. Paul Meunier with us. Dr. Meunier is a physician and an expert in infectious diseases and has been very involved with us in our plans and our management of the coronavirus issue. We're going to talk for a moment or two about plans, not getting too detailed because we simply don't have the time to do that, but as we reflect upon where Thibodaux Regional has been over the last 20 or 30 years, there's a lot of things that have come along unexpectedly and that we've learned from. There's a lot of effort we've made to improve the systems, the processes, put the right people in the right place where we can get the optimal outcomes for patient care. And so some of that's reflected by awards we've won that measure how good are you. Also government type of measurements like the star rating that CMS or Medicare puts out. Thibodaux Regional is a 5-star hospital, for example. I think it's the only one in Louisiana that measures up to that level, and it's a very, very high apex kind of performance. So while we're not arrogant about that by any means, not at all, our experience with that part of our journey and hurricanes and other events that are significant in their proportions, we think have helped us prepare to deal with things like coronavirus. But today we want to assure the public and those that use our facility and others that may, that we have a plan. We have a disaster plan. It's a detailed plan, and we put it into effect. And we're working that plan, and it has worked well for us. Dr. Meunier, you want to talk about it because you've also been a part of these significant efforts to improve patient outcomes and patient care.
Yeah, no doubt. I mean, we have the experience to deal with this. I've been highly involved in these quality improvement initiatives here and all of our efforts to prevent hospital-acquired infections. One thing I learned as I've grown in the system and it was involved in these projects is that, the concept of being agile and being able to change when called upon. And I think that's helped us in the last few days as this organization can when facing a challenge that requires quick change and quick action, we're able to put that into place, and that's evident to me right now. But I would comment on just the thoughts of the public with some of the things that our government are doing, some of the things we're doing as a society to reduce the potential exposure to this virus. I think it's important for the public to understand that some of these hard decisions that we're making at this time are designed to, and maybe you've seen it, it's called flatten the curve. And we want to basically spread the cases out. So if we can avoid these crowded rooms and events and so forth, then ultimately we would hope that we won't see a spike in these cases all at once, which will help us and every other healthcare center to take care of these patients as they present.
Thank you. Thank you for being with us today.